Okay, here we go.
Okay.
Good morning. It is October 5th at about 8:30. I'm getting ready to go for my first, they call therapeutic rec outing, and we are going to what is called the Chatfield Farms. I didn't get to finish what I was talking about last night, and I wanted to make sure I recap that and then finish a few little details about their happenings. Laura, my oldest sister, has arrived. She's sitting next to me, and she's going to come in here and show her pretty face. It's good to have her here. I was informed that it is my nephew Carter's birthday tomorrow. So happy birthday, Carter. The big one, 6. Remember, driving is a privilege. It is not a right. So be careful out there. You're a great driver, and I know you'll do well. Hello to all my family, of course, all my friends. I'm drinking some coffee this morning, which is really nice. Trying to get my coffee mug right now because I'm a little parched. But see this stainless steel straw. Yep, good coffee in room. Making some coffee every morning. So if you're here, 6:30 a.m. coffee's ready. So you get here first. You get a cup. Skin program. That's what I was talking about when I left off last night. One of the most important things that spinal cord injury people go through is they'll have skin issues. Too much time on their back, too much time on their butt, not moving. You can't move your legs. So your sacrum, as they call it, your coccyx area, has a lot of pressure when you're sitting up in your wheelchair. So that's why we do things called weight shifts. So every 15 minutes in my power chair, I tilt back to a 45-degree angle to get the weight off of that and kind of make sure that we don't get any skin issues. So always checking me twice a day for any new lesions or anything growing and growths and blah, 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 blah. You get it. So like even last night, I had a zit on my leg. They found it. They're like, we'll watch that. Okay. Which is really common for me, not that you need to know that. But it happens. So all the little things can turn into infections, and those infections can leave you bedridden for weeks. And that's a problem for your PT and recovery, especially like me right now, where I'm ready to go mentally and physically and making big strides. So we don't want anything to hang me up like a bladder infection or skin lesion. So it's a big deal. So that's why I say that's part of the Craig advantage. I'm sure other rehab centers do the same thing for spinal cord injury people, but Craig is like, you watch these videos and this is what you're going to do. And it's one of those videos, kind of like the STD video in health class, where you watch the video and you're like, oh my God, I don't want to see that, but it's like, it's an impact thing. It's like to make sure that you are making your weight shifts. They roll me on my side and back to my other side every 2 hours at night. So, skin. But Monday morning, we woke up and was ready to go to my PT. Went to PT, and they were inspecting me, and they're like, oh, there's a spot. We better keep an eye on that. And nobody thought anything of it. And then went to PT. I poured some water on my lap by accident because I spilled my water glass and didn't think much of it, but then went and they had me on the mat, and I'm on my butt and on my back and rolling around and doing all this stuff. Well, the lesion that they saw was actually an abscess, and it burst. So that caused all sorts of red flags, and I was back in bed at 5 on bed rest. So they were inspecting. I had a crowd of people looking at my bare ass, and it was the talk of the town. So they got right on it. Everything's been good. I've had a lot of extra time during the day. They've got to change the dressing, and that's on the wound, and keep it good. So it's going the right direction. It's not infected. It's draining. It's healing. It's just going to take a little time, and that also will set me back towards my pool therapy goal, which is one of the big reasons why I came to Craig too, is they have a great pool therapy where you get in the water. There's a treadmill underwater, and it's super nice. So I got my Speedo ready, but it's going to have to wait a little while. So that's the only real other hang up. But otherwise, they did get me back in my chair. Luckily, they're like, nope, we'll just got to keep an eye on it. You're not having any pain. I don't have much sensation down there. And they've been able to make sure that I stayed on my normal PT, OT schedule, going to my power-up class, which is new this week, and riding the E-Stim bike, yada, yada. Anyhow, so the power-up class is a fun one. It's just weights. And they already, I think there's been a picture circulated from what's called the Peak Center. That's the gym here. the big gym downstairs, and I was doing some chest press or something like that. But they had me do chest press and some dips, and then these crossover bands, and a lot of just like the muscles that I have, they're working really hard to stabilize my shoulders and get shoulders and biceps, because they work keeping those things strong, because they have methods for, you favor those muscles then to be able to do the things you need to do, like sit up in bed, put on your socks, like there's tools, and their goal is getting me to independence, and whatever that looks like. So the independence is, basically being able to take care of myself and get out of bed, get in my chair if I'm still in a chair, get me to PT myself, eventually get into a car, so it's all these things that's really the goal of everything they do at Craig. So still super impressed with the care here. My nursing staff is amazing. There's always somebody around no matter what, and it's just been really fun. I love my doc. He's a funny guy. Yeah, good team. So my doc, actually, Dr. Balazzi, is the director of the Craig Hospital, so the medical director. He has a very small patient load, so I'm on it, and I feel pretty lucky that I'm under his care and supervision, because I gotta imagine he's probably the best, or one of the best. If he's the medical director, he's been here a long time. So big shout out to him. Yeah, so that's, I think, about covers it. The exercise feels really good. Sleep has been a problem for me. They're knocking me out with some sleep meds till I get like a solid 6 hours every night where I'm pretty comatose, and then I wake up at about 3, and the last couple nights I've had some sinus issues. My sinus gets plugged up, and I'm breathing through my mouth, and then I'm not comfortable and not able to sleep again. So last night was the night where we got it figured out, and I got a pretty good night's sleep. So the night before was only like 3 hours. Last night I got probably a solid 8. Well, not solid, but I broke it up. Went back to sleep from 4 until 6:30, which was awesome. So a little groggy this morning. I can see my eyes are, hanging a little heavy. But in general, I am doing really good as far as meds. They've got me off the nerve pain med. They've got me off the Scalaxin, which is a muscle relaxer med. I'm very high, or kind of really strong NSAID, so like ibuprofen, a little bit, like 50 milligrams twice a day, and that's about it. And then blood pressure med. Keeping my blood pressure up is really important, because my legs aren't circulating as much blood. So blood pressure, as I sit up, I've got to make sure I've got blood pressure med on board, which is kind of like caffeine. Just kind of keep everything moving a little bit more, because your legs aren't able to compress that blood. So always monitoring blood pressure a couple times a day. And that's something I've become more aware of too, as we start getting into standing stuff. I've already done what's called a standing frame, and they start basically standing your legs underneath you to put pressure back on your bones and your joint to increase bone density, as well as like get the core engaged, get the torso working a little bit. And then also it's forcing my blood pressure to improve throughout that, so I can get off the blood pressure med and actually stand up. Other interesting things, I thought Joe was my primary PT, but actually it was Rose. So this gal Rose I just met yesterday for the first time. She just got back from a vacation, and she's great too. So all in all, still an awesome team. Getting better with the iPhone. I've got a lot of accessibility stuff. I've got this new stylus that's kind of strapped to my hand. I'm able to actually put this on myself, which is kind of fun to do. It's a little challenge for myself, not being able to use the fingers really well. But I've also figured out how to use the phone with this really well, so I can do a lot in the voice commands. I'm getting better with too. So getting real comfortable with Siri. So she'll be the one I'll be talking to the most for the next 6 months, I'm sure, as time goes on. But any tips and tricks people have for me, I'm all ears. And that's it. So again, thanks to everybody for the well wishes. Hopefully everybody's caught my first YouTube video. And that I'll just try to keep these coming and try to keep it interesting. Right now it's like, me talking is probably a little boring for some people, but the easiest way to catch up with everybody, unless it's like instead of a phone call. So I'll try to get pictures of things that are going. I'm trying to get people to take pictures and vids of me doing my exercises in PT. My sisters have been great about putting some of that on Facebook. And we have now, I've got to make a correction. It's not Caring Bridge. It's
Lots of helping hands.
Lots of helping hands. is the site. So you find me on there. There's where the calendar is of like who's coming to visit when, and you can request a visit. You can have people, you can basically request that with my sisters, and then you can put on any events that you guys want. But that's where I'm going to try to post all these videos, the links to the YouTube videos. So you can subscribe to my YouTube channel, or I'll put them out there, and we're going to try and keep linking that to like put it on the GoFundMe site and stuff. Oh yeah, and a huge shout out. Thank you, everybody. The GoFundMe site. I had never would have thought that in a million years that kind of support would have come that quickly. So you guys are great. I don't know what I did to deserve it, but I'll take it. And I'll just keep on doing my best for y'all. So keep the faith. Talk to you soon.